In the last video, we saw some of the important questions of your IHBAS 2024 previous year question paper, and we also made this PSG guide for you so that once we are finished with all the 10 parts, you will get this guide in your drive. Okay. Alright, so we have also checked the important questions and that questions as well that are not going to come anyway in your examination. And in this part, we are going to start from our question number 11 and we will finish till question number 20. Make sure that you can watch this thing 24/7 any number of times you want, you wish, but the priority is you have to do this thing regularly until and unless you are getting your result. Okay, I mean, you are sitting in the exam hall, you will solve all the questions with very high accuracy. Just revise these PYQs and more importantly, do the CC mock series. Okay, all right. Question number 11 says that functionalism, an early school of thought in psychology, was most closely associated with which psychologist? Okay, options given as Edward Tishner, William James, Stanley Hall, or is it John Watson? Okay, so what is the correct answer over here? Correct answer over here is simply your option number C, William James, and he was the propounder or founder of your functionalism. Now, what does functionalism is doing? It talks about stream of consciousness. Okay, in the IHBAS paper, there was a question that who has discussed about stream of consciousness. So it was given by whom? Given by William James. Now, this same William James guy was in 1875 doing psychology courses, okay, before the final laboratory was even established. Okay, so you have to remember this thing. In 1875, William James started taking courses of psychology. Okay, just like you are watching this video, this guy William James also started taking psychology courses and all those things right before in 1879. Before 1879, he had already started taking psychology courses. Okay, now Edward Tishner, where we can associate Edward Tishner, we can associate this thing with your structuralism along with Wilhelm Wundt, but Edward Tishner is the main one for your structuralism, and he used which method? Used introspection. Okay, introspection was the method used in structuralism by Edward Tishner, and then we are having this John Watson. Why we are having this for behaviorism? So he is associated with your school of behaviorism, as well as it officially started in 1913 when he published a manifesto called as psychology as a behaviorist views it. As a behaviorist views it. If they ask you question on chronology, you will be able to answer that as well. Okay, and G Stanley Hall, what he did, he was the president in 1892. APA founded, American Psychological Association was founded by whom? Founded, okay, I am just messing in the next question. APA was founded by this guy G Stanley Hall in 1892. Okay, now as you can see, this guy, his name is what? His name is G. Stanley Hall, and he was the first president of your APA. So if they ask you who was the first president of APA, what you will answer? You will definitely answer G. Stanley Hall because you know very well. And when was the year? The year was 1892. Okay, 1892 was the year when he was the first president of APA, American Psychological Association. And this guy you will be knowing definitely, and this might be or might not be. So his name is Sir Sigmund Freud. Okay, 1900 published the book Interpretation of Dreams, and this is C. Jung or Jung, however you want to pronounce as per your tongue suitability. Okay, so this is C. Jung guy, and this is G. Stanley Hall, and what they are doing, three of them together, because G. Stanley Hall in 1909 invited these two for something to tell something or what not, but that is none of your concern. But what is your concern is Sigmund Freud, G. Stanley Hall, and Carl Jung met in 1909, where met in Clark University. Okay, all right, so now we are done with this particular question and we have explored all the options as well, A, B, C, D. Okay, all of them. Now moving forward, next question is asking about Leon Festinger is best known for developing which psychological theory? Options given as operant conditioning, cognitive dissonance, classical conditioning, and social learning theory. So operant conditioning is given by whom? Is given by B.F. Skinner, and B.F. Skinner on the basis of what? On the basis of law of effect. law of effect. On the basis of law of effect, he proposed his own theory of operant conditioning. Without this law of effect, he might not be able to do that thing. And who was there to help B.F. Skinner? His name was E.L. Thorndike, Edward Lee Thorndike. And this Thorndike guy gave what? He gave three laws of learning. Laws of learning were given by whom? Not operant, not Skinner, not Festinger, not Bandura, or not this Pavlov. Laws of learning were given by E.L. Thorndike. Now, what are these laws? These laws are, first of all, law of effect, law of practice, and law of readiness. And this law of effect was the first one that was taken by B.F. Skinner smartly and used as his own operant conditioning. Now, option number second, cognitive dissonance, is very, very IMP, and this is the correct answer over here, given by Leon Festinger. Okay. Along with that, he has also given one more theory, which is called as the social, you might not be knowing, comparison theory. Okay. So if you are not knowing, make sure that you hit that like button in this video. Now, what is next? Next is your classical conditioning. We all know classical conditioning given by Ivan P. Pavlov, and he received Nobel Prize. When he received Nobel Prize in 1904. Okay, Nobel Prize was given in 1904, and this social learning theory given by your Albert Bandura for that Bobo doll experiment and all those things over there. Albert Bandura, social learning. Along with that, he also gave a concept of reciprocal determinism, which needs three persons, I mean three things: person, people, and behavior. Person, situation, and behavior, this triangle. You will go to the C book, you will find this thing particularly over there. And he also gave the concept of self-efficacy. Okay, so all these things were given by whom? Given by your Albert Bandura. Okay, all right, so with this we are done with this question. Moving forward, next question is asking about savoring is a concept in positive psychology that involves A, B, C, D. Avoiding negative experiences, enhancing the enjoyment of positive experiences, minimizing stress through relaxation, and reflecting on past traumas. Okay, so when did this positive psychology started? It started in 1998. 1998 by whom? 1998 by a person named as Martin Seligman. Okay, now there are currently two waves going on for positive psychology. One is by this Martin Seligman, another one is by that young guy, okay, Dr. Paul, something like that, which is none of your importance right now. Savoring is a concept in positive psychology. Who started positive psychology? Martin Seligman. Only Martin Seligman, yes, and he also gave some things like as your VIA classification, called as the values in classification, and it is 6 into 4 is equals to 24 character strength and things like that. Okay, along with that, what else Martin Seligman talked about? He talked about learned helplessness. You can refer to NCRT and C book as well for this thing. Along with that, he also gave learned optimism, and through this learned optimism he did this positive psychology and all those things. And what else? And he wrote book called as the Authentic Happiness. Authentic Happiness is the book written by whom? Written by Martin Seligman. And in this Authentic Happiness book, there is a model called as the PERMA model: positive emotion, engagement, relation, management, and all those things. Okay. All right. So what is savoring is doing over here? Now, first of all, we will understand what is savoring. What is savoring? What is the correct answer over here? Correct answer is your option number B. That is enhancing the enjoyment of positive experiences. So whatever positive experiences you are getting, you are going to do what? You are going to enhance that positive experience. Okay. This is referred to as savoring. Now, question should arrive in your mind: who has given this concept of savoring? It is given by someone called as Bryant. You can call it Bryant or Bryant, whatever you want to pronounce as per your suitability. But it is given by Bryant, and this is a concept of positive psychology that involves enhancing the enjoyment of positive experiences. Now, there are three types of savoring: first, second, and third. Three types of savoring. Okay. And to make it easy for you, it is simple like the past, the present, and the future. Okay, so three types of savoring can be done: for the past, for the present, and for the future. Now your knowledge of English language will come into picture, because For past, we will say the word called as REMINI, reminiscence. I will call it as reminiscence. You can call it as reminiscence, or for more clarification pronunciation, you can also call it as a reminiscence. Okay, it completely depends upon you. But for some purposes, I will call it as reminiscence so that it becomes easy. And savoring the present is simply saving the present. And what is this for? Future is for your anticipation. Okay, so you will anticipation is for savoring of future. You are anticipating about your results, the positive thing that should be. Okay, so these are the three types of savoring: reminiscence, present one, and the anticipation. Okay, and this is the correct answer. Along with this savoring, there is one more concept that is very similar, called as what? Called as flourishing. Where should I write? Over here. The flourishing. What does flourish means? Flourish means to, like what we can say, to flourish. It's simply just flourish. You can just Google what does flourish mean. It is very difficult to explain, but flourish means flourish. After completing all these videos, you will flourish with the knowledge. Okay, some bad example also. Okay, so flourish. And one thing is important: what happened in 2001 apart from you were born, that is important. B and B theory. Okay, this is referred to as broaden and build theory, given by whom? Given by, okay, we have discussed this earlier also in free video, Barbara Fredrickson. Okay, so Barbara Fredrickson gave in 2001 broaden and build theory just 3 years before the tea tsunami. Now, moving next, question number 14 is saying social identity theory posits that individuals derive part of their identity from. Now, this question is directly from the C book. For this, you refer to C book. Simply C book. Their economic status or status, their group memberships and social categories. Okay, I am remembering some CMP membership over here, and their personal achievements or their personal preferences. And you can just simply read from here: social identity theory, theory in which the formation of a person's identity, let's suppose you, within a particular social group is explained by social categorization, identity and comparison. This is also important. CIC, not CFC. Categorization, identity and comparison. These three you should remember. It is important. Okay. Social identity theory given by whom? Now you will try to find out who has given this thing. So you just need to come up over here, and it is given by whom? Tajfel and Turner, 1986. So now this becomes very easy. Social identity theory given by whom? Given by Tajfel and Turner. Their economic status? No. Their group memberships and social categories? Yes. Their personal achievements? No. Their personal preferences? No. Okay. We can also relate this to attribution, personal preferences, but we will not do right now because that would not be very suitable or very appropriate as per the recent context. Now, moving forward, next question coming up shortly, that is our what is halo or halo effect. What is the halo effect? The tendency to judge other based on their group membership. No, we are not going to discuss about this. The influence of a positive trait on the perception of other traits. This is the correct answer. Option number B is the correct answer. The influence of a positive trait on the perception of other traits. You are looking at an actor that is a A-class actor in Bollywood, Hollywood, Tollywood, Bollywood, whatever that word is, and you are also watching that there should be definitely possible that all the positive attributes you can associate with this particular actor, but that is not the truth. Why? Because he is doing some tobacco ads and some smoking ad and some drinking alcohol liquor ads. Okay, so this is not the reality, but the influence of a positive trait on the perception of other traits is referred to as the halo effect. Now what is the duplicate of this thing? The reverse. The reversal will be done like the halo, and it will be called as the horn effect. Okay, don't remember Karen Horney. This is the Horn effect. What does this Horn effect stands for? It stands for the negative. If you found or if you have seen something negative for someone, you will always associate that, okay, everything else will be the negative side. So halo effect is for the positive and this one HO is for the negative. And this is the correct answer for this particular question. The tendency to overlook negative behaviors in individuals. No, this is not the correct option. The effect of initial impressions on subsequent judgments. This we can refer to as the impression formation or the first impression. This is for your first impression. However you perceive that person, that individual for the very first time, the initial impressions will form your subsequent judgments. Okay, the tendency to overlook negative behaviors in individuals, all these options have no relation. The tendency to judge others based on their group membership, that you will do when you will read more about that in C book for this particular chapter. The tendency to judge others based on their group membership, you are just doing what? You are just forming their impression on the basis of their group, and that is not the halo or horn effect. The main two keywords here, halo effect and horn effect over here, or halo effect. Next question, who developed the stages of cognitive development? This is very important question, and you will find this question coming up shortly in your exam as well. Who developed the stages of cognitive development? Options given as your Sigmund Freud. Obviously everyone knows it is Jean Piaget. Now what are those stages? First of all is the sensory motor. Second one is the pre-operational. Third one is the concrete operational. And the last one is the formal operational. You should definitely remember exactly what is happening in what stage. I mean, what is happening in what stage, or which stage, what thing is happening. Okay, because this is very primary, this question, because I don't want you to miss on these easy questions. Object permanence or permanence is going to happen in the sensory motor, conservation, reservation, and that all those things are happening over here. And abstract thinking is going to develop finally in the formal operational. But if they want to ask the difficult question, they will always form from the pre-operational or the concrete operational, because this is more confusing. See, to make it more easier, you have to just remember what is not happening over here will happen here, what is not happening over here will happen here, and what is not happening over here will happen here. Just same thing. Okay, I mean not same thing, just a simple thing for you. Whatever is not happening in the first stage will occasionally happen in the second one, third one, and fourth one. Like that you can remember. So if you have to just remember one thing, is the conservation happening over here, irreversibility is coming over here, and what all things, symbolic thought and pretend play, what are coming. If they come over here, then definitely they will not come over here, because they are being subsided or they have been changed by some other things. Okay, because the child is now grown up. So in this way you should remember for this particular thing, and this is a very important concept for you. Okay, mark my word, this is very IMP, and this is definitely going to come in your examination hall, and you will remember this. Sigmund Freud is talking about the topographical model. He has given the topographical model as well as the structural model, and he has also given the psychosexual stages, and the mnemonic for that is OAPLG: oral, anal, phallic, latency, genital. The Electra complex and the that one Oedipus complex is going to happen in the this stage, phallic stage. Eric Erikson has given what? Eric Erikson has given your psychosocial theory, psychosocial theory of development, and we have discussed about the 8 stages. Those are very IMP, from trust versus mistrust till ego integrity versus despair. You have to remember all these things, very important. And now talking about Lawrence Kohlberg, Kohlberg has given you moral development, and in this moral development, what you will learn? Okay, I have space over here. Congrats to you. Moral development, what will happen? Pre-conventional, conventional, and post-conventional. What is happening? To see in the C book, the diagram is given. Just remember what is happening over there, and it is very IMP. They will definitely going to ask question from Lawrence Kohlberg very soon. Okay. Now moving forward to next question, that is our question number 17. Which personality assessment tools uses ink blots to assess thought processes? Now over here only and only one thing is happening. Rorschach's test is going to use the ink blots given by Hermann Rorschach in 1921. It was the year 1921. Okay, and MMPI is a Minnesota multiphasic personality inventory, and it has lie scale, validity scale. You have to remember that thing, and it is given clearly in the ebook. Myers-Briggs type indicator. This MBTI is based on the theory of Carl Jung over here, and thematic apperception test was given by Murray in 1935. 1935, if I'm not wrong. Yes, 1935. Henry Murray thematic apperception test. Also, there are children apperception tests and all those things. There's also an Indian adaptation as well. For that, you need to refer to the ebook because it is given in so deep over there. Okay, you have to read from there. It is very IMP. Okay, and this is the projective one. Rorschach's test, this is the projective one. This is content one. Okay, so this is very, very important. Thematic apperception test and Rorschach's test 1921. And this is a important concept. Which personality assessment tool uses ink blots to assess thought processes? And how many cards are there? There are 10 cards in your Rorschach's ink blot. Okay, how many cards are there? There are 10 ink blots, 10 cards. Okay, how many chromatic, achromatic? Read from the ebook, you will get over there. Okay, now coming up next is your which disorder is classified as a neurodevelopmental disorder. Neurodevelopmental disorder. And the question is so simple over here because OCD, obsessive, it is a compulsion disorder, it is a personality disorder, and it is a anxiety disorder. Attention deficit hyperactivity disorder is the only one over here that is called as the neurodevelopmental disorder. Attention deficit, attention is very, very less in that person and hyperactivity is going in that child, and we will call it as a neurodevelopmental disorder. What is happening in OCD? It is you are obsessed with something and you are compulsive, or you are having compulsion to do some things that is required for that particular thing. Okay, borderline personality, you are shifting your personality here and there. And generalized anxiety, this is very, very IMP. You have to read from the C book no matter what. OCD, this thing important, you have to mug up all those things, what is happening, what is not happening. Generalized anxiety disorder is very, very IMP. They are going to ask you about phobias as well, and they have mentioned agoraphobia, agoraphobia, hematophobia, and all those things. This is very, very important for you. Okay, generalized anxiety disorder, what is happening? Anxiety disorders, personality disorder, OCD, and this thing is very, very important. Now let's look into next question, but before that, which disorder is classified as a neurodevelopmental? So my work starts over here because I need to encode this thing in your mind, what is happening, why we are, even you might not be knowing, you are studying, you are doing reading, good, that is good, but you might have skipped somewhere sometimes in your mind or while reading. What is a neurodevelopmental disorder actually? First of all, we need to understand the meaning of development. What does development means? Development means that a child is going from the stage of infancy to the old age. Fair enough. From infancy to old age, this is going on. Infancy to old age, this is our development. All our development is going like this only, from the stage of infancy to the stage of old age. Okay, now we are developing in this way. We are healthy, we are fine, we are fit, we are developing normally. But now what happens is, in this cute little child over here, there is some problem. Wait a second, some problem. This cute little child has some problem while he or she was growing up. Okay, this, they are having problem. What problem? It is a problem. Okay, not a physical one, it is a neuro problem. What does neuro stand for? It stands for the neuron. Okay, so in neuron means there might be something not proper neuron functioning, all those things. So after this neuron is made up, what it is making up, this is a basic component, but what it is making actually, it is making the nervous system. Okay, right? So in this neurodevelopmental disorder, we will have defects, or we will have impairment, not impairment exactly, but we will have disability and all those things in the nervous system most probably. Okay, nervous system. And in nervous system, it is definitely going to be the CNS, not the PNS, because the main thinking and all those things, the brain and spinal cord are the important component over here in your CNS. Okay, so this is called as a neurodevelopmental disorder. So whenever there is a harm, there is a trouble in your CNS or your brain spinal cord in small children, cute little children's, we will call it as a neurodevelopmental disorder. And not a single child is going to have GAD from birth or while he is developing. Okay, so when we will see this neurodevelopmental disorder? In early childhood. Early childhood is the time when we will witness these disorders. Okay, because the child is at home, there is no trouble, but when he start going school, playground, all those things, we are witnessing trouble in that particular child, and it is referred to as a neurodevelopmental disorder. I hope now this is clear to you that what is a neurodevelopmental disorder, and it is happening while you are developing. Okay, it is not inherited as of now. What does the term neuroplasticity refer to? Now first of all, What does the term brain plasticity neuroplasticity refers to? It is the correct answer over here is option number A, the ability of the brain to change throughout life. Okay, your brain is not fixed. Your brain, the ability of the brain to change throughout life. Now in this question, the ability of brain they have given, but you can also associate why they have not written brain plasticity, because brain is also a part of your nervous system and it can also refer to as the nervous system as well. Okay, so the ability of the nervous system, I mean the neuroplasticity that is going to happen, it can happen in any neuron. Does not need necessarily to happen in the brain only, but it is the ability of the nervous system actually to change based on its own experiences and all those things. Okay, so the ability of the brain, or we can also say the nervous system, to change throughout life because of some injury. Maybe your neuron is functioning properly, but due to some injury it is not functioning or its functions have changed. Okay, so the adaptability, the plasticity that we need in our body, in our nervous system, in our brain, in our spinal cord is that thing which is referred to as the neuroplasticity. Okay, the brain's protective coating, it is not the correct answer. Brain cell death is not the answer, and memory loss has nothing to do with this thing. Now next is our the brain's protective coating. What is this called? This is called as the meninges. Meninges is what is your meninges, the brain's protective coating. What is the correct order for that? Is, as you can see over here, the dura mater, the arachnoid and the pia mater. Okay, so these are the three layers which are protecting your brain. This is the skull, this thing, first one right below your ear is the skull, and then you are having the, you can remember how you can remember like the mnemonic D, the dura mater, the arachnoid matter and the pia mater, DAP as well. Okay, dura mater, arachnoid matter and pia mater, these three layers are combined forming what? These are forming the meninges, and these meninges are doing what? These are protecting your brain from further damage. Okay, so you can see over here the meninges of brain, meninges, the skull, then you have this arachnoid matter, this is your subarachnoid space, this is your pia mater, and this is your dura mater. Dura, arachnoid and pia is the most important, and as you come down you will see in your brain you are having the gray matter and the white matter. That is because of the multiple, not multiple sclerosis, but that is due to the myelin sheath. So how you will remember the meninges, the dura mater, the arachnoid matter and the pia mater, DAP, are the three meninges. Memory loss has nothing to do with this thing, and brain cell death, this can happen in number of types. There are two pathways, the necrotic pathway and all those things, but that is not so required right now. Now, question number next, who is known for their work on observation? And if you want brain cell death, then we will discuss in our upcoming video. Who is known for their work on observational learning and the Bobodal experiment? Options given as Sigmund Freud, Albert Bandura, B.F. Skinner and Carl Rogers over here. So as we all know, it is the correct answer is your option number B over here, that is your Albert Bandura, and we have already discussed about this all these in this video, but we will always revise once again because option number B, Albert Bandura, is the correct one. He has done his work on observational learning. Along with that, he has given what? Along with that, Albert Bandura has given first of all the concept of self-efficacy. So it will help you with this PhD guide to revise again and again those topics. Okay, because you might not do on your own. Self-efficacy. Along with that, he has also given the concept for your reciprocal determinism, and he has also given this Bobodal observational learning done, and what? And your social vicarious learning and all those things, social learning theory, SLT. Okay. Now talking about what is left, Carl Rogers is left. We have not discussed about it yet. About him, not it. About him, we have not discussed it yet. And for that, this is your SLT. Carl Rogers has given your client-centered therapy and the following what approach? The humanistic approach. And the three primary conditions that are required is first of all the congruence or congruence. Congruence is required. Second is your that one empathy, and third and the most important is what the UCR, called as the unconditional positive, UPR, unconditional positive regard. These are the three primary tenets of Carl Rogers therapy, client centered therapy. Along with that, He talked about the real self and ideal self as well, why we are having some psychopathology or we are behaving abnormally, because there is no congruence between the ideal self and the real self. Sigmund Freud, we also discussed about this thing, born in 1856, gave OAPLG, psychosexual stages of development, and all those things. And B.F. Skinner gave what? He gave us operant conditioning based on laws of learning, that to the law of effect of E.L. Thorndike. Law of effect. Okay. And he also proposed what? Wait. He also gave what? He also talked about what? Talked about radical behaviorism. And this is what we have done in our previous video about B.F. Skinner. Alright. Okay. With this, we are finished with this part. That is part number 2. See you all in the next part. That is going to be a part number 3. I hope you are like this video. You enjoy the content. You are learning some things which you might not be learning on your own. So make sure that you watch the complete series of this 10 video, and wish you all the very best for the upcoming examination. You will definitely score high. The cutoff is going to be high. So you have to prepare very well. Be very accurate. And see you all in the next video. And in the next video, we start from the graphical representation of correlational data is called as.